My name is Ellie, and I'm excited to be presenting on the benefits of music therapy on different neurological disorders, the topic that I've been researching with my mentor, Anna. My presentation will have a few main parts. I will first discuss my research question, and then I will move on to defining key terms. Afterwards, I will be talking about how music is processed in the brain. I will go on to cover the origins, types, and benefits of music therapy, along with how music therapy can impact patients affected by stroke, Parkinson's, and Alzheimer's. Finally, I will talk about conclusions and takeaways from my research. My main research question for my project is, how can music therapy improve cognitive function and quality of life in patients affected by stroke, Parkinson's, and Alzheimer's? I chose this question because music is a passion of mine, and I wanted to learn how music could be used as a non-pharmacological way to improve patient outcomes. Now I'd like to establish and define some key terms mentioned throughout my project. Music therapy is a form of treatment that uses music experiences, such as playing, listening, or composing, to promote health and well-being. I'll talk about music therapy in more detail later on in this presentation, but something important to keep in mind is that music therapy acts as a complementary approach to medicine. That is, it's currently used alongside traditional Western medicine, but not as a primary form of treatment. These next two definitions are somewhat self-explanatory, though I'd like to give some examples. Cognitive function involves mental abilities, such as memory, attention, problem-solving, and language, and quality of life focuses on general well-being, including psychological state, relationships with others, and physical health. Before we move on to music therapy, let's start with music in itself. How is music processed in the brain? I'll start with the auditory pathway, the pathway that sends and processes signals from the ear to the brain, and then I will move on to talking about music processing within the brain. In the auditory pathway, sound begins as waves or vibrations in the air. These vibrations travel through the ear canal to the eardrum, which causes movement in the eardrum. This movement vibrates the ossicles, which are three small bones in the middle ear, which sends these vibrations to the cochlea, this spiral-shaped structure here. These vibrations move the fluid of the cochlea, which in turn moves hair cells within the cochlea and causes the release of neurotransmitter at the base of these hair cells. This creates an electrical signal which is sent through the auditory nerve and to the brain. Within the brain is organized into multiple lobes, each controlling specific functions. For example, the frontal lobe is involved in movement, reasoning, planning, and problem solving, and the temporal lobe is important in auditory processing, language comprehension, and memory encoding. Though the auditory cortex located in the temporal lobe is one of the first areas of the brain that processes sound, many parts of the brain are involved in processing music, as shown by these brain structures, all listed here. I have color-coded each brain structure so you can find the general location of the structure based on these two diagrams to the left. Technical aspects of music, such as pitch, key, melody, harmony, rhythm, and sound quality, are processed in the auditory cortex, cerebellum, prefrontal cortex, and motor cortex. Though music can also trigger emotion and memory-related responses involving the nucleus accumbens, amygdala, cerebellum, and hippocampus. And practicing or performing music activates the cerebellum, motor cortex, sensory cortex, and visual cortex. As shown, music engages and activates many different parts of the brain, something important when considering rehabilitation strategies. So, why is music used for therapy? The use of music to impact health has been an idea since pre-literate societies before writing existed, where music was used during rituals for healing purposes. But in terms of modern music therapy that we know today, early systematic experiences and experiments in music therapy were documented in the 1800s. Today, receptive, compositional, improvisational, and recreative methods are common in music therapy. Receptive music therapy involves listening to music and reflecting on its impact. It can include activities like guided imagery with music, where the therapist helps the patient visualize scenes or emotions inspired by the music, or song discussion and sharing songs and music. It is often used to reduce stress, improve mood, and enhance relaxation. In compositional music therapy, patients create their own music. This can involve writing songs, composing instrumental pieces, or creating lyrics. It's a powerful way that patients can express emotions, process experiences, and build self-esteem. Improvisational music therapy focuses on spontaneous music creation. This type of music therapy encourages creativity and emotional expression, helping patients explore and process their feelings non-verbally. And finally, recreative music therapy involves performing pre-composed music. Clients might sing, play instruments, or participate in musical ensembles, which can help motor skills and social interaction. Studies have shown that music therapy has many benefits across different types of health. For example, music reduces the levels of the stress hormone cortisol, benefiting mental health by reducing anxiety, depression, and stress. Music also benefits cognitive function by enhancing memory, attention, and problem-solving skills. Emotional well-being can be improved with music's ability to improve self-esteem, emotional expression, and resilience, all of which are extremely important to the overall mental health of patients. And music processing also involves the motor cortex and releases endorphins, contributing to physical health by alleviating pain, supporting rehabilitation, and improving motor skills. Music therapy also promotes neuroplasticity, which is the forming of new neural connections in the brain. This can help the brain develop new pathways that compensate for damaged areas of the brain. And finally, in the case of group therapy or group music therapy, social skills can be improved with group work's ability to strengthen communication, social interaction, and teamwork skills. These benefits can especially help patients affected by conditions such as stroke, Parkinson's, and Alzheimer's. Stroke is the blockage, reduction, or disturbance of blood supply in the brain. Most strokes, about 85%, occur in patients greater than 50 years old, with stroke affecting millions worldwide each year. A stroke can occur in two ways. In an ischemic stroke, the blood vessel is blocked or reduced through a blood clot, and this can result in a disruption of blood flow. And in a hemorrhagic stroke, a blood vessel ruptures, causing internal bleeding. The disruption of blood supply in the brain causes brain cells to be damaged and quickly begin to die. Stroke is a leading cause of death and disability, and effects can include paralysis, usually only on one side of the body, muscle weakness, problems with speech and memory, vision changes, and sometimes difficulty swallowing. Music therapy can be powerful in stroke rehabilitation due to its ability to engage multiple brain regions and promote neuroplasticity. This is crucial for stroke recovery as it allows healthy parts of the brain to take over functions lost due to brain damage. Music therapy for stroke patients also uses rhythm and melody to help stimulate the brain. In rhythmic auditory stimulation, or RAS, movement can be improved by helping patients synchronize their steps to a beat. And melodic intonation therapy uses the brain's ability to process music and language differently, aiding in the recovery of speech and language skills following a stroke. Additionally, listening to music can stimulate structural changes in brain areas responsible for memory, attention, and mood regulation, which are often affected by stroke. Parkinson's disease is a progressive neurodegenerative disorder affecting motor and cognitive functions, primarily diagnosed in people aged 60 and older. It is the second most common neurodegenerative disorder in the United States. PD results from the death or impairment of neurons, particularly in the substantia nigra, which produces dopamine, an important neurotransmitter that helps coordinate movement. With a 60 to 80% decrease in dopamine-producing cells, Parkinson's patients often have symptoms like tremors, rigidity, difficulties with balance, slow movement, and speech problems. Because dopamine also gives a sense of pleasure and happiness, the loss of dopamine also causes depression and mood changes. In addition, PD results in the loss of norepinephrine-producing nerve endings, affecting the regulation of bodily processes. This affects non-motor symptoms such as blood pressure fluctuations, fatigue, and sleep problems. Music therapy can significantly benefit individuals with Parkinson's disease by using the brain's rapid response to rhythm and melody to improve both motor and non-motor symptoms. RAS is particularly effective in enhancing movement coordination. By synchronizing movements to a musical beat, patients can experience balance and mobility, and music therapy can also help stimulate dopamine release, which may help alleviate some of the mood-related symptoms of Parkinson's disease, such as depression or anxiety. Furthermore, engaging in music therapy can enhance cognitive functions, including memory and attention, by activating various brain regions simultaneously, as mentioned before. Alzheimer's disease is a neurodegenerative brain disorder that primarily affects memory, reasoning, and thinking. This is the most common type of dementia, accounting for 60 to 70% of cases. It mainly affects those aged 65 and older. Symptoms worsen over time, starting with short-term memory loss and progressing to a loss of independence and a difficulty with daily tasks. In AD, neurons develop these, which are tau neurofibrillary tangles and amyloid beta plaques, leading to brain changes such as damage to the neuron connections and cerebral cortex and hippocampus, causing brain tissue shrinkage. These results mean behavioral changes, memory loss, and difficulties in decision-making and problem-solving, significantly disrupting daily activities. Music therapy can be very beneficial with those living with AD by engaging multiple brain regions and promoting neuroplasticity. This is particularly important in AD, where brain cells are progressively damaged. As mentioned earlier, music has the unique ability to evoke memories and emotions, even in late stages of AD. Listening to familiar music can help patients recall past experiences and improve their mood. Music therapy can also enhance cognitive functions such as attention, language, and executive function. Studies have shown that music can stimulate brain areas responsible for these functions, potentially slowing cognitive decline associated with AD. It can also reduce agitation, anxiety, and depression in AD patients because of its release of dopamine to provide the feeling of pleasure or reward. To conclude, music therapy is a promising and evidence-backed option for rehabilitation in patients affected by stroke, Parkinson's, and Alzheimer's. There are numerous physical, psychological, and cognitive benefits to music therapy that contribute to the enhanced brain function and quality of life. But the benefits of music therapy have the potential to reach even further. I chose these three conditions in particular because they are all commonly associated with old age. People will inevitably age, and with our population and our life expectancies increasing, the number of individuals affected by these conditions will likely increase as well, placing a larger burden on the healthcare system. Each year, families and governments spend significant amounts of money on care for these conditions, but by incorporating complementary approaches like music therapy, these costs may be reduced while also improving patient outcomes and hopefully reducing the need for intensive medical intervention. In my opinion, the integration of music therapy into an overall treatment plan for patients affected by these conditions is a compelling choice, given its many benefits for patients and beyond. And that is the end of my presentation. Feel free to submit any questions or feedback through the Google form on the right, and thank you so much for listening. I hope you enjoyed.